Now, much closer to home, Alberta NDP leader Naheed Nenshi and Shadow Minister for Health Sarah Hoffman were in Lethbridge on Tuesday night for a healthcare town hall at the Galt Museum. The Alberta NDP has been very critical of the UCP over their healthcare policies, and residents in our city got a chance to voice their concerns. BCN's Landon Hickok was there and has more now on the issues in healthcare that residents expressed their various concerns about.
Lethbridge got to hear direct answers from the top of Alberta's opposition party on Tuesday night, as Alberta NDP members, leader Naheed Nenshi, Shadow Minister for Health Sarah Hoffman, and MLA Dr. Luanne Metz overheard testimonies and answered questions from residents on the topic of healthcare. In the shadow of an upcoming Lethbridge West by-election soon to be called, some residents of Lethbridge are voting on the basis of the city's current health challenges, some with challenges of their own.
I am so grateful that so many people came out today and that so many people with real lived experience came out and were willing to share their stories. I mean, it was heartbreaking to hear of people living in chronic pain, waiting for surgery, people unable to work, people who have been made even more ill because the system was not there for them. And the fact that so many people are waiting for a family doc. And right now there are 0 family doctors accepting new patients in Lethbridge. So I'm really grateful for it because it's important for me to hear these stories so that we can amplify them and try and make the system better.
Other issues brought up were a lack of funding, facilities, and high wait times. Lethbridge, a hub of southern Alberta with a large regional hospital, is heavily relied on by many rural residents, as emergency services in smaller communities are forced to close on occasion due to staffing shortages.
Telling somebody that you need to drive when public health care includes making sure that every person in the public can be able to access the services that they need, and it should be the right care in the right place at the right time.
In response to Premier Daniel Smith's announcement on the restructuring of Alberta Health Services, Sarah Hoffman says this could cause even more healthcare workers to walk out.
What she is proposing at this point is massive system overhaul. She knows it's not working. That's why they're adding another system to try to talk about implementation and accountability, because there's already so much chaos just with the piece that they've done around Recovery Alberta. We're losing nurses, we're losing other healthcare professionals because they don't want to be part of another chaotic reorg or redraw of the system. We saw what happened with the privatization of labs when they stopped the building of the public lab that we were doing as a province. Then they decided to sell everything off to Dynalife. Then they had to buy back what they'd already sold from Dynalife and pay them more, and it caused chaos for patients. We know how the wait lists were incredible and unacceptable for lab results, and so much begins with getting that information.
For Bridge City News, I'm Landon Hickok.
Now make sure you catch the full interviews with NDP leader Naheed Nenshi and NDP Shadow Health Minister Sarah Hoffman on our website, bridgecitynews.ca.